Okay, good evening, everyone. In the interests of time, I'm going to start this webinar. The webinar is how to identify cybersecurity risks and data breaches in your practice. Very relevant for this day and age. Our presenters are both from Avant. First of all, I'd like to acknowledge the country on which I'm working from tonight. So Northwestern Melbourne Primary Health Network would like to acknowledge the traditional custodians of the land on which our work takes place, the Wurundjeri Woi-wurrung people, the Boonwurrung people and the Wathaurong people. We pay respects to elders past, present and emerging, as well as pay respects to any Aboriginal and Torres Strait Islander people in the session with us today. I'd also like to acknowledge that this land was never ceded, and it was, is, and always will be Aboriginal land. Thank you. Just a little bit of housekeeping. It's a Zoom meeting. Now, all attendees will be muted, and please keep your microphone on mute. Just that background noise of people eating dinner and stuff gets quite distracting at times. If you could ask your questions via the chat box. And this session is being recorded so that we can actually share it afterwards with the participants. Please ensure you join the session using the name you registered with so we can mark your attendance. Certificates and CPD will not be issued if we can't confirm your attendance. So how to change your name in Zoom meetings. If you could all have a little look at that slide. No point me reading it out to you, but if you're Jane Example or if you're Amy iPad, please change your name to the registration name that we have. Just give you a minute or two. So next I'd like to introduce our speakers from Avant. Cheryl Wood is a risk advisor. She holds a Masters of Business Administration and is graduate of the Australian Institute of Company Directors. She was previously the Executive Officer of the Inner East Primary Care Partnership, which was a precursor model in Victoria to Medicare Locals, which of course then became Primary Health Networks. I think anyone who's been in general practice long enough knows that story. Cheryl has extensive experience in managing specialist medical practices in regional and metro Victoria and in New York City. She's also been an Australian Association of Practice Management State Committee member and certified practice manager. Cheryl has a passion for lifelong learning and a specific focus on the value of mutually beneficial partnerships. And to Ruth Crampton, who has expensive experience. Was it expensive, Ruth, or just extensive? In healthcare, including in nursing. She has a postgraduate qualifications in education. Ruth has published research from her PhD and been the keynote speaker at several international health and nursing conferences. Her education experience has been in hospital, university, and corporate environments. For the past 7 years, Ruth has held her role at Avant, focusing on promoting quality improvement, safety and professionalism within the medical field. Her work primarily involves coordinating medico-legal education through live events, online content and activities. So without further ado, I'll get Cheryl, looks like Ruth's the first speaker, is that correct? Yeah.
Hi everyone, I'm just sorting out my screen. All good? Yep, okay, great, thank you. So thanks for having us, and Cheryl and I both work for Avant in the Melbourne office, and we both have a lot of experience that we can contribute to today's talk, but there's a couple of things that we don't have, and one is neither of us are lawyers, and neither of us work directly in the insurance part of the business. So questions about the law and about insurance, we may have to refer on and get back to you. But in terms of the practice environment and the people that things that we know about cybersecurity, data breach, communicating with patients electronically, we're happy to discuss and answer any of your questions. And we'll stop and answer the questions at the time if you put them in the chat. So thanks for having us. We're happy to be here. So as I mentioned, the things we'll be covering is cybersecurity issues, and then issues surrounding data breach. Now, those two things do really overlap, but they still have some quite separate elements that are different from each other. So we'll talk about what those are. Talk about digital communication with patients in terms of ways that you can communicate through SMS, email, telephone calls, with a focus on emailing patients, because we do get a lot of questions about whether that is or is not a safe thing to do. So we're happy to talk through that towards the end of this talk. And we anticipate this chat will go on for about an hour. So let's get cracking. So I'm starting off with some chat about cybersecurity. So in terms of cybersecurity and why it's an issue, we certainly have seen, as everybody's aware through the media, a big jump in the problem that is cyber attacks, especially malicious cyber attacks. And recently, the Australian healthcare bodies did a study and found that only a third of institutions and practices had really embedded cybersecurity awareness training into their policies and procedures. And some places had policies and procedures, but their staff really didn't know what they were or how to enact them or what to do if they had a cyber attack, or if they came across something that they thought might be a cyber attack. And one of the problems is that you get continual faults within the system, and that those faults have to be patched, and that 58% of the time a cyber breach occurred when there was a patch available to stop that vulnerability. So people just weren't or aren't keeping their systems up to date. So it's interesting to to think about that, and to think about what the processes are for keeping them their systems up to date and current. And one of the things that we recommend is the Australian Cybersecurity Centre has a website that you can subscribe to, and so you can get email alerts from them to let you know what the latest threats are and what the latest advice is about mitigating those threats. And we recommend that somebody in the practice signs up to this page and has on their email the latest updates, and then that person can filter them down through to the practice. But it's a really useful site for keeping you current with what the types of emails that you may need to be wary of, for example, in terms of a phishing attack. When I did the snip of this page, they were talking about passphrases for better security. And so that's the latest sort of trend when it comes to best practice. Instead of a password, having a passphrase. So 3 to 4 words that mean something to you that might, that another person wouldn't be able to necessarily guess. And that I just thought it was worth diverting now to talk a little bit more about passwords. But I found this interesting graphic, which is how safe is your password, and how long it would take somebody to crack it. And interestingly, that if you have 6 or less letters with one uppercase letter, lowercase letters, one number and one symbol, it can be instantly cracked. And it takes a lot of letters and numbers in order for it to be hard to crack. So you want one of those ones that is 12 letters long with at least one uppercase letter, takes 300 years to crack. And that's where a passphrase comes in, because it is, multiple letters. And if you can add a number or a capital letter in there, it takes much longer. It's much harder for someone to crack. So that's where the benefit of that passphrase comes in. So, a line from a song, or an old address, or, I don't know, something cute, something that you can remember. Now that website, the ASIC website, the Australian Security Cyber website, has what it considers to be 8 essential best practices, which is what the practice needs to do to keep your system safe from a cyber perspective. And I'll just explain what these are in, like plain language, because some of them are a bit wordy. So the first thing they recommend is application control. So application control is taking charge of what people can download onto the practice computers and the practice laptops. So not letting people download, Facebook necessarily, or a game, or, some other type of social media, having quite strict controls. And then if somebody wants to download something that they need for their work, then that has to go through a checking system with your IT provider to make sure that it's safe. The patch applications, as I was explaining, they're a quick fix to a small problem within the system, and that's why your iPad or your iPhone or phone constantly wants to update, because it's updating these patch applications to address known problems. And then configuring of the Microsoft macro settings, that's the shortcuts that you can allow, the things that you allow Microsoft to do in the background. And it's important that those are limited to things that are only approved processes, and that you can't change what those are, that only the IT providers that you work with in your practice can change what those macro settings are. Application hardening is when you log on to a website or you log on to an app and you get all the flash content and the cookies and all those kinds of things that come with it. And it's just making sure that those things aren't hanging around and backing up and clogging up your system. And so it's making sure that you've only got the pure application that you're wanting and not all the peripheral stuff that might come with it. And within the system, disabling that stuff that's not needed. And so that's something that your provider can do. Restricting administration privileges. So who has the authority to go in and change things need to be limited to a small amount of people that know what they're doing. And not every staff member should be able to go in and make changes and updates. The patch operating systems, it's a systematic approach to that one-off patch application. So it's really, in terms of the way I understand it, to be a very similar thing. Multi-factor authentication. So we all know these days that most of the times you want to log into the bank or log into any of those kind of systems, they're asking us for multi-factor authentication, and all practice logins should be multi-factor authentication these days. If they're not, you should get more security advice about that. But it's getting a text message to your phone with a PIN code, or asking for 2 ways to confirm who you are. So it's not just logging into the system, putting your name and your password. It's another step. And this second step, is frustrating and slows you down. But most systems, and increasingly, this will become a normal thing for everything that we do. And then finally, the last thing they recommend is to do daily backups of your system. And so the backing up of your practice records and your practice software is a really important thing that we recommend that you have ideally 3 copies of your practice systems. So one is the working files that you're using every day. One would be a version of that that's saved on the cloud. And then the third thing would be a hard drive that is regularly downloaded from your systems to make a backup copy, and then kept somewhere completely different from the practice. So kept in a taken home and kept in the practice manager's safe, or stored off-site in some other location, and then but regularly updated, so that if there was a local emergency in your practice, like a fire or a flood, you've got something you've got something in place. And the other thing is to make sure that you test these and to test that they're working, because we've heard lots of stories of practices that have had a problem and they've thought, oh, it's no worries, we've got everything backed up on the hard drive, and then they've gone to get the hard drive and it hasn't been automatically backing up as they were promised that it would. Or they go to the cloud and the cloud, there's a fault there and it hasn't been saving, it hasn't saved for 3 months, or, you know, these kinds of problems are quite common. And so it's not only having them, but making sure there's a system in place that these backups are checked and tested. So one aspect about cybersecurity is that the human factors, the way that people respond to an issue, that really matters. And 60% of cybersecurity instances are attributed to somebody within the practice that has done the wrong thing, and that has you know, clicked on an incorrect email, or sent something to the wrong person, or you know, or fallen for some kind of scam while they've been at work. And Cheryl's got a few examples of that she's going to talk to us about.
Thanks, Ruth. Yeah, we all hear about these things, listen to the radio, watch TV and the news, and you'll hear about where some poor person has been scammed. A couple of examples that we've come across. A general practice owner had received a fraudulent email. The email appeared to be from a legitimate supplier from whom the business had recently purchased equipment. Attached to the email was an invoice. The details contained in the invoice matched a recent purchase. The practice owner therefore thought that all looks legitimate. It appeared to come from the correct organisation. It appeared to have all of the right logos and all the information. So they forwarded it to the bookkeeper. The bookkeeper didn't verify that the bank details were different to what they had paid previously, and went ahead and made that payment. And as a result, the practice unwittingly paid thousands of dollars into a bank account to a cyber criminal. We hear about that often. Certainly, our practices, we would recommend that they hover over the email address and make sure it still looks legitimate when they receive an email. Check the bank details before making a transfer to make sure if they have paid these people previously that that is still the correct email address. And certainly if it's large amounts of money, it's often useful, and you'll find that a lot of organisations now recommend that you contact the person by phone and confirm that you are actually paying the right person. That said, also make sure that the phone number that you've got isn't the one that's necessarily on the invoice, and you've looked it up from separate data to make sure you're actually calling the legitimate organisation. Another example, I recently had a practice that contacted me to advise that one of their staff had inadvertently clicked on the link in a spam email. The staff member didn't think much of it, but they were then contacted by a patient who'd received an email that was supposedly from this particular staff member. The email contained a QR code, and when someone scanned the QR code, they were then prompted to enter personal details. The practice had alerted their IT support, and they discovered that the hackers had actually gained access to the inbox of that staff member. Through the initial click that staff member had made in that link, hundreds of spam emails were then sent to contacts or recipients of emails from that staff member's email system. The IT support identified that the hackers had gained access, and it was for less than an hour. So it just shows that this can go very quickly, but they got onto it really quickly as soon as they were alerted. And from my understanding, nobody had actually entered the information. They'd all checked prior to doing that. So it's really important to make sure first that staff are trained to, one, identify spam emails, and certainly if anything were to occur, that there is a policy and procedure in place as to what you would do. And just one of the things that Avant often does at various periods during the year, they'll send out spam emails to all of the staff just to test whether staff are able to identify potential spam email. Obviously, these emails don't contain anything sinister, but it's always a good reminder for staff to keep on top of emails when they open it. And it might be something that you might think about contacting your IT support to see if they're able to assist with exercises like that.
Great, thanks, Cheryl. Okay, so the next slide is just the reminder that, you know, unexpected things can happen. And, you know, I'm from New Zealand, so I've got earthquake in there. Although I don't know who else felt that earthquake that was like a couple of weeks ago. I'm in the eastern suburbs, and it certainly I felt it. But we all know fires, floods, you know, lots of things can happen and disasters can strike, and you really need to be prepared for this. And there's two parts to that process. The first part we've already mentioned, which is having backup systems in place that back up regularly and that are checked regularly. And the second thing is to have a sound recovery plan, a plan as to what you're going to do if the worst, you know, scenarios can happen. So, so if something does happen, you can quickly pivot and respond and know what you're going to do. If your practices, for example, become uninhabitable for some reason, if your systems all go down for some reason, you've got plans in place for those situations. And if I haven't said it enough already, one of the most important things is making sure everything's backed up. So in terms of the policies and processes that a practice might consider in terms of cybersecurity, there's a couple. The first one is a cybersecurity policy. So this is information for the staff to let the staff know what best practice is and what the expectations are. And that's the things that I mentioned about, you know, the access to the system, the use of backups, the whitelisting of applications, administration privileges, which staff can access which data and for what reasons. You know, what's the rules around your password? You know, what's the rules about what you can plug in? Like one practice had a cyber incident, and it was all the result of a staff member plugging their phone in, and they didn't plug it into the PowerPoint. They plugged it in their cable into their computer, and it was that way that the virus entered the practice system. So rules about all that sort of stuff, rules about who can take devices off-site like laptops, and you know, what sort of password protection they need. So that's your cybersecurity policy. And then the cyber response plan is what to do if you suspect that you've had an attack. So in this policy, you should have the contact details for all your IT providers, the roles and responsibilities of staff. So, for example, the practice lead, their responsibility is to, you know, be the face for the media, you know, write the notifications to the patients. And the practice manager's responsibilities are to contact all the patients and organise, you know, appointment times because the appointment system's gone down. You know, that type of thing. So everybody knows what their jobs are and what to do if it was to happen, so that the practice can get up and running again as quickly as possible. And so how to realize that you're under an attack is something that we get asked about a lot. And typically, you know, what will happen is that, you know, your computer won't turn on, your screen doesn't look normal, or it keeps turning on, turning off, turning on, turning off. Your browser just jumps around to pages that you haven't searched for. You know, you get a lot of like pop-ups on your screen, your mouse doesn't work, your scanner doesn't work, your printer doesn't work, you know, those types of things. And it's important to know to be able to recognize immediately that you're under attack. What you don't want to do is you know, to respond, to assume that it's nothing, and to respond in a really, you know, lackadaisy way where you're not taking it seriously, and then you can really make the situation that much worse. And Cheryl's got a few examples of that.
Yeah, Ruth, we do have an example where one of our practices that we were assisting on a Saturday morning, one of their most junior staff members was working by herself. As you explained, she noticed that the computer was running slowly, wasn't responding as she would expect. She did struggle through, as most people would do when your computer's running a bit slow. The first thing we do is to reboot. We complain and blame everything. She struggled through the morning. And at the time, the practice manager had also gone away skiing, and there was nobody else that she could ask for advice. Unfortunately, whilst the system continued to operate, the infection actually got worse and got deeper into their system as a result of it actually still being operational. And one of the learnings from this is that a lot of practices don't think that they necessarily need to have someone that's available to assist with their IT system after hours. These things can happen at any time, day or night. It might be on a weekend, it might be in the early hours of the morning when you think about sending an email prior to going into the office. In this instance, there was nowhere for this staff member to have easy access for who to contact or what to do. So we would always recommend printing and laminating a flowchart that explained what a staff member should do should something like this occur, ensuring that staff are trained, as Ruth said, to make sure that they're able to identify if something goes wrong, and also have contact details for IT support, and make sure you negotiate with your IT support what is available and how something can be made available if something were to occur, not during business hours, but really ensuring that you are training your staff to detect when something is wrong and giving them permission to ask for help if something seems to be off. If it seems to be off and it's not going well, people sometimes just think it's them, but just to be super cautious and keep an eye on what's happening and know where to go, and maybe even doing some practice system issues and playing around with, okay, as Ruth had said, having a plan in place, what happens when there is a cyber attack. So having a plan in place is great. Actually implementing it and practicing that plan is really useful. So something to think about doing. We do that for evacuation systems. So certainly think about how you might be able to implement something like that from a cyber attack perspective as well.
Thanks, Cheryl. And one thing I've been told several times by practices that have undergone or come out the other side of an attack is that they were under the assumption from their IT provider that their security was all sorted and that they were safe from cyber attacks. But what they'd realized in hindsight was that their everyday IT provider wasn't necessarily the right person to be managing their security and their cyber safety, and that potentially you need two IT teams, one that looks after your everyday IT support and a second team that looks after your cybersecurity matters. And even if you are relying on one team, it would be good practice, I think, to get an audit done by a specialist security team of your systems every now and again to say to you, yep, your IT support team is fine, everything is fine, you're safe, or to say, actually, there's a few faults in your system that you may want to consider doing this or that. Because what a lot of people who have I've spoken to have had a cyber attack is, in hindsight, their systems weren't secure, but they were reassured from their IT support teams that they were. So getting an audit done or getting a second opinion, like in medicine, it never hurts to have another opinion just to make sure that everything you are doing is what you should be doing. So if you are attacked, the important thing to do, the immediate first aid, is to unplug everything, disconnect everything, and not just the computer you're working on. So if you're in a reception area or in your office, not just to disconnect your desktop, but also to go around the whole practice and unplug everything from the power, disconnect the printers, disconnect the scanners, so everything is in isolation and nothing is talking to each other. And to do that in the first instance. And then the next step would be to enact your cybersecurity plan, assuming that you have one. And in that plan, you should have the information of who to contact in terms of the cybersecurity team, who to contact, and in order of the most important to the next important down. So maybe the first person you contact is the practice manager, if that's not you, and the next person you contact is the IT security team to get advice, etc. And just go through the flow chart of what to do and in what order. But that should be predetermined. That should be something that everybody knows what to do and in what order. So it's a sort of a situation. I used to say it's not if but when that you have a cyber attack. But then I went to a seminar once and the person presenting said, it's so cliche how everybody says not if but when, that really what the message should be is be prepared. The message is be prepared, so that you know, if something does happen, you know what to do and you know how to do it, and your staff know what to do and how to do it. Now, we get a lot of questions in around the issue of should we pay the ransom or not. So on our website, there's a podcast where I interviewed a doctor whose practice was had a cyber attack. So what happened was, this was a cardiology practice in Melbourne, and they their systems were locked down by a malicious attack where they were demanding a ransom, and the practice had 3 servers, and they were demanding $3,000 per server. And the content in their servers wasn't compromised. It didn't go anywhere. It didn't go past their firewalls, but it was locked down so that they couldn't access it. And so they decided that they weren't going to pay the ransom, which is the advice that everybody, the police, the privacy commissioner, the cybersecurity office, they also don't pay the ransom because you only make the situation worse. That is generally the advice, and that is generally advanced advice. But in reality, it can be really hard to keep going and not pay that ransom. So this practice kept going for 6 weeks without paying the ransom and without having any access to their patient data. And so they originally they had paper copies of things, and then eventually their IT team set up a fresh system where they were putting their information into. And then just before the 6 weeks was up, they had a patient who was a journalist, and that patient leaked the information of the cyber attack to the press. And then it was quite early on when these things were not as common, and the press then was all over the practice, camped outside, and all wanting to know all the details. And then at that point, the practice decided to pay the ransom, and they negotiated it to be $1,000 per server, so $3,000. And in terms of 6 long weeks with no access to your patient data, $3,000 is actually quite cheap. But that's the catch, because they make it not too expensive so that it's not prohibitive, so that people are more likely to pay. Anyway, this practice paid the $3,000 eventually, not straight away, but eventually they got access back to their patient data. But then they were in a situation where they had 3 copies of patient records. They had the original copy, the paper copy, the fresh system that was set up copy, and then they had to safely integrate all that information back to one. So it was a really drawn out, stressful experience for them. And it's a really interesting podcast if you're interested in more details. And the trouble with paying a ransom is that it identifies you as a compliant victim, so you're more likely to be prone to another attack in the future. But you've got to offset that with the disruption to your patient care. And so that's a decision that each practice has to make. This was one of the people that I spoke to who said that they thought their systems were safe, and they realized that they didn't have the right level of support from their IT provider, and that they needed a separate security provider. And the other thing was that they thought their data was backed up, but it actually wasn't backed up, because they had followed advice that from their service provider that it was all safe in the cloud. But when it came down to it, it wasn't as safe in the cloud, and they couldn't access it either. They couldn't access the cloud or their systems. It was both locked down. So the next question we get asked quite a lot is, can you still see patients? And so, yes, you can, but the planning, this should be well planned. So you should have resources available just in case. So those resources, could be kept in a storeroom in a plastic storage box, but they would be things like a current diary, for a 2023 diary, so that you could put patient appointments into it. It should be the contact details for, if you could print a patient list and get a list of contact details every 6 months or something, so that you've got at least the majority of the patients you need to contact. the information for the, the pathology people, the radiology people, whatever, whoever you use regularly, because then somebody's job can be to contact those people and ask to be resent, all the recent results. So of course you can keep seeing patients, and each patient should be treated as a new patient. You need to start again with a new history, a full history, and on a paper record probably in the short term. But Cheryl's going to talk to you about what the risk advice is around this situation.
Yeah, Ruth, thank you. And as Ruth said, our advice is certainly to treat a patient as if they're a new patient. Make sure you take a full history, check for allergies before any medications are prescribed, ask the patient if they've had any pathology or imaging, and check if there's anything that's outstanding, particularly before recommending another course of care. Make sure that you're documenting everything in paper-based records. But as Ruth explained, this can create a bit of a problem down the track as well, because you're going to need to somehow have a system as well to be able to integrate those notes back into the medical record to ensure that you have that ongoing continuity of care. Again, that also provides you with another risk, is that if you do keep paper-based records and you're normally using a system, you now have that issue of how do you file them? How do you ensure that things are kept in order? How are they secure? So let's say that this is something that's happened and you now have patient records in a paper base and you have a break-in. So ensuring that you're actually keeping those secure, and it might be something that's completely different to what you're used to doing. So thinking about all of these eventualities and how you might respond in that instance. As Ruth said, it might be something that's really quick. You might be able to get access to your system within a day. But if it's a couple of weeks, a couple of months, thinking about how you might be able to manage that and weather that. And keeping clinical staff updated on a regular basis as to how long the systems are likely to be unavailable. Providing staff with notepads, script pads, whatever is required, and again, ensuring that they're all retained securely. But having a plan for eventually being able to put the hard copies back into your practice system. So thinking about the need to scan them and how you might be able to ensure that the information gets put into the patient medical record. So once you do get back again, you're able to continue with that ongoing continuity of care. We'd also recommend you create a document, a spreadsheet for any patients that you're referring for tests, to ensure that there's a robust test tracking process in place, so you're aware of who you've sent for tests and you're able to monitor that as we would normally advise for any other time, ensuring that those systems are not only there from a day-to-day perspective, but they're able to weather this issue if you don't have access to your medical records and your system in general.
Thanks, Cheryl. So moving on to the imaginary cyber attack process. So the next thing that often occurs with a cyber attack is a loss of data. Now, in the example that I gave you of the cardiology practice, they didn't lose any data. Their data was locked in their system behind their firewall. So it was safe in that sense, that it didn't leave the premises, it didn't leave the practice. It was safe there. They couldn't get to it, but no one else got to it either. So it wasn't a data breach as such. Often what happens with a cyber attack is that there is a data breach because the malicious attack takes data, but not always. So you need to be clear whether data has been lost or whether it's just been locked down in your system. If data has been lost, then it moves this discussion into the next phase, which is what happens if you have a data breach, which we're going to move into next. I did just want to go back over the whole system in terms of just to talk about patches, firewalls, virus protection, and how that relates to your system, because I like to use an analogy of a house and a robber, a burglary. is about to be undertaken in your house. And so first of all, if you have a big security fence around your house, then that's what a firewall is. A firewall is a physical type structure that surrounds your house or surrounds your IT system, that keeps it safe and keeps intruders from getting in. Now, if for some reason an intruder was to get in, then you might have in your house an alarm system that would let you know that somebody has breached your firewall and gotten into your system. And that's the sort of analogy that you can relate to antivirus software. So software that lets you know if somebody has breached through your firewall or is trying to breach into your system. Now, a patch is like if you had left the front door unlocked, or if you had left a window open and all you needed to do was to shut the window and lock it and it would be safe. But because you've left the window open, the burglar was able to get into the house. So a patch is a simple fix to a known problem, such as shutting a window or locking a door. So I hope that analogy helps you make sense of all that IT talk. So the next part of the discussion, we're going to talk about data breach. And data breach, as we said, overlaps with cyber issues, but it can be other things. Data breach can be sending an email to the wrong person. It can be losing a memory stick or losing a laptop. So we'll look at the issues around data breach. So the Privacy Commissioner has an annual report, and just a couple of weeks ago they released their report for the last financial year. And so privacy complaints, so this is a patient complaining because in reception they overheard somebody talking and mentioning their diagnosis, or there was a story recently about a receptionist's son got seen by a GP at the practice, and she looked up his notes to see what the problem was, and it turned out it was an STD. And then she went home and yelled at him, and then he made a complaint about his privacy breach. This is the type of privacy complaints that have increased by 34% in the last year. Freedom of information complaints, so that's people asking for their records or asking for something and being denied, or that's a very small part of the problems. But notifiable data breaches have had a slight increase from last year, and this is things that the Privacy Commissioner has asked to be told about in relation to patients in our situation, but customers or bank customers, or any other sort of service providers, information that has been breached or lost. And in terms of who gets privacy complaints, the biggest sector that gets privacy complaints is finance, but the second biggest sector is health service providers. So those privacy complaints continue to be an issue for hospitals and practices. And in terms of data breach, the complaints, the top 5 areas, actually health service providers were the top, and they usually are the top in terms of groups that fall victim to data breach complaints. And as I said, these data breach complaints can often be, most often, a malicious attack. So the orange, that 70% is a malicious attack, but then 25% human error and 5% is the result of a system failure. And then if you look at the malicious attacks, ransomware is a big part of that, and then stolen credentials, so people trying to mimic your bank account, phishing emails, those types of things are what has led to data being lost. So if we're looking here at an example of what a privacy breach is, so let's say, for example, there was a doctor in your practice and they left their laptop behind at the airport. it's not their work laptop, it's their personal laptop. And so there's not a lot of patient information in there, but there is information of, let's say 3 or 4 patients that he's kept on there because he was hoping to do a bit more review of their case, or he was hoping to, read some notes or something while he was traveling. And in relation to a data breach, you have to consider whether the data breach falls into the category of what's considered serious. And the terminology that's used by the Privacy Commissioner is whether the data breach is eligible. And an eligible data breach is one that contains sensitive information of, it could be as little as 1 person, or it could be a breach that contains not very sensitive information, but personal information for a lot of people. So let's say 1 person's HIV results versus 1,000 patients' address has been breached. Both of those would be considered serious or eligible. So you have to make a judgment as to whether the breach could cause serious harm to the individual or to the group of people that it has affected. And so what you would consider as eligible is that serious harm to 1 person, or a lot of information about a small amount of information for a lot of people, but it's not an eligible data breach. It's not something that you need to report if it's something that you can take remedial action for. So say if the doctor's laptop that he left behind at the airport and he went to security and he found it, then that's not an eligible data breach because you've mitigated it, you found the laptop, there's been no harm. Or say you lose a memory stick with patient records on it, but the memory stick's password protected, then that probably wouldn't be considered an eligible data breach. But if you can't mitigate if you can't fix it, if you can't, go and find the thing that you've lost, or delete the files remotely or something, and then it may well be considered to be an eligible data breach. And so if you do have a breach in your practice, the first thing is to assess it to determine whether or not it's eligible. This cardiology practice, where their records were locked down but they didn't breach their firewall, so they didn't notify the Privacy Commissioner because they had been assured by their IT providers that the data wasn't taken by anyone. So they assessed it as being fine. But actually, once the media got involved, the Privacy Commissioner contacted them and said, why haven't you told us that you've had this cybersecurity attack? And they said, oh, we didn't, because we didn't assess it as an eligible breach because the content didn't leave our systems. And the Privacy Commissioner said, okay, prove it. So then they had to get their IT providers to go through and provide the data which proved that the information wasn't lost. And then the Privacy Commissioner said, okay, that's fine. But if you do assess it and you assess it as an eligible breach, then you have to notify the Privacy Commissioner, and you also have to notify the people affected. Now, it doesn't necessarily mean if it's 3,000 patients in your practice that you have to make a phone call to 3,000 people. You are able to do it en masse, so you're able to put a notice on your website or put a notice in the public paper, in the local paper, or something like that, that will get the information out to a large amount of people. But of course, often what happens, and I got one today, actually, a letter from a pathology service to say that, we've lost some data, and you may or may not have been affected, and as soon as we know more, we'll let you know. So I think what commonly occurs is that letters get sent to the people that were affected. You're obliged to investigate it within 30 days. So you've got a limited amount of time in which to do, to do this. So you can't just let it fester, for too long. Okay, Cheryl.
So there's other examples of potential data breaches. And in this particular example, thinking about a doctor in the practice who's moving to set up another specialty practice in the same area, and there's some concern from the practice owners that they will take their IP from your system with them. That might include patient contact details. They might even look into your system to try to copy and download policies and procedures and other IP that's owned by the practice. So thinking about when you're looking at your policies and procedures and ensuring that you've got robust IT policies and procedures that talks about who has access to what information. As Ruth had also talked about, having some of those access control measures in place. So talking to your IT vendors to be able to set up systems to limit access control. So limiting the amount of information that somebody can have access to, that they can only download or access information they legitimately need to access. This might involve a discussion with your IT support vendor, talking to your medical record IT vendor, whether it's best practice, medical director, or one of the others. We also often recommend Train IT. Katrina Otto is a consultant who consults on some of the system capabilities, particularly for best practice and medical director, but certainly some of the others. And she has lots of free resources on her website. So having a look at her website to see if there's any recommendations as to some system control measures that could be put in place. Certainly managing remote access. If somebody's going to want to try and download some of your IP from your system, they're likely to want to try to do that outside of hours. So just thinking about who has access to what, when, and how, and making sure that in contracts, you're ensuring that people are signing confidentiality agreements and are aware of the IP responsibility within the practice and what systems are in place to avoid that being accessed and taken from your practice. I'll often see, I'm on a couple of practice manager forums, and often people are willingly sharing some of the policies and procedures and other templates that are from the practice. And often people will come up and say, isn't that IP of your practice? So educating your staff around who has the ownership and what they're able to access and share. It's great to be working with everybody and ensuring that we're all sharing the knowledge, but making sure that you're also protecting your own intellectual property in your practice.
Hello, sorry, I am here, but I've turned off my video because my internet's a bit crappy. So sorry if you can't see my face, but let's keep going. As Cheryl mentioned, access to your system, control who has access physically and by the network, and that the information is protected so that not all staff need to access all parts of the system or need to be able to all look at the medical records. And the Privacy Commissioner does have 5 best practice tips in terms of data protection. And so the first thing is employee training, so make sure your staff are all well trained. Preventative technologies and processes. So this is just making sure that your systems are well supported and well backed up. As we've been talking a lot about being well prepared, assessing the harm and the post-breach communication. So what we've found is that a lot of the problems or complaints from patients don't come from the actual incident, but they come from the practice not being upfront about what's happened and perhaps trying to hide what's happened, or not telling the patients the whole story, or the patients finding out from the media that something's happened rather than directly from the practice. And so managing the post-breach communication is important, and we'll talk about that now. This is just an example of that practice that I mentioned, and this is the notice that they had on their website, just advising patients there'd been a cybersecurity incident, that the data was decrypted, the systems have been restored, patient privacy was not compromised, and they just tried to explain really carefully exactly what had happened during the process. I just missed a slide here, but I just did want to talk to you about what happens, the best practice if there is a breach. And that's really just to be upfront with your patients, be respectful, be transparent, and just make sure that the communication, you keep the communication coming, so that you don't just make one statement and then don't bring any updates. You keep regularly making updates, and usually that would happen on your practice website, but that patients are really kept apprised of everything that's happening. And on our event website, we do have a cybersecurity page, excuse me, which is publicly available. And on that page, there's 3 or 4 15-minute e-learning courses that all your staff can do, that just goes through some of the safety issues, how to identify phishing emails, you know, those kinds of skills that we've been talking about. So moving on next to talk about digital communication, excuse me, and emailing patients. Really, from a practice perspective, a lot of this is about having the right policies and processes in place. And there's a lot of policies and processes that relate to this topic. So first of all, I've already mentioned these, which is the cybersecurity policy and the cyber response plan. But also there's the policies that relate to data breach. So first of all, there's a privacy policy that you should have in place for your staff. So that outlines staff behaviour, the training, the electronic communication guidelines, how patient data is stored, the expectation on staff about, you know, they won't look at patient records unless they're directly involved in their care, and, you know, all those kinds of things. There's a patient privacy policy, as I'm sure you all know, that's publicly available to your patients, and that outlines how you collect and use their data and information, and what you do with their records, how they can access their records, how they can make complaints about privacy. And that's usually publicly displayed either in the waiting room or on the website, or both. And then there should also be a response plan for a data breach, so that if you do have a data breach, you know exactly how to contain it, how to assess for harm, who to notify, what information is required, and perhaps, you know, links to the relevant websites from the Privacy Commissioner in terms of the forms you have to fill out, so that you know exactly what to do. And in terms of emailing patients, which is our last topic, we get a lot of questions about this, and so Cheryl's just going to talk to you about a few examples.
Yeah, thanks, Ruth. Yeah, so a few examples that we've come across with assisting our members. So there was one practice who had a male patient. He had terminal cancer, and he had a particularly anxious wife, and therefore he hadn't told her that he was going through getting testing and talking to an oncologist. The practice had an email that was sent to him that he was to take to the oncologist, but they didn't password protect the email. They didn't verify with him that it was okay to send this, because it's not a general email they would normally send, and they sent it to him because it went as an attachment for him to be able to take the letter to the oncologist. It was easily able to be opened, and it was inadvertently accessed and opened by the wife, who obviously was very upset. This is how she's finding out about this, and this has also resulted in a complaint about the patient's privacy being breached. We all see emails getting sent to wrong email addresses. One of the things when I worked in our practice that used to concern me was when patients used their work email address. We would certainly recommend to people, when you're getting email addresses from patients, to ensure that if they're providing work email addresses, just verify that they're happy for emails to go to that email address. We've seen instances where we've also had complaints and claims where a patient has provided their work email address. The practice hasn't checked to confirm that the email address is still current. They've got consent from the patient to contact them via email, but without checking, there's no way of verifying that it's still accurate. Oftentimes when people leave their employment, they will have their emails forwarded on to a colleague. And we've certainly assisted members with complaints about privacy breaches where this has occurred, where their emails have been forwarded on to somebody else, whether it's their boss or somebody else within the organisation, and they've been able to gain access to this private information that they shouldn't have. Also, we've had issues where we've supported practices where faxes have been sent to the wrong number. Having fax numbers, we don't use them that regularly. I don't understand why we still use them so much in health, but this is what happens. Those fax machines, or even when they're through a multifunction centre and you've got the fax number that's saved, double, triple checking that that fax number is the correct one that you've selected. We've also had instances where we have had information that's either been emailed or faxed to a patient. A staff member has picked up the information that needs to go, put it on the fax, and realised after it's actually gone that there's a couple of extra pages at the back that relate to somebody else. So ensuring that staff are double, triple checking everything prior to actually sending it. If the Privacy Commissioner does come into your practice because there has been a privacy breach, they'll want to review your systems. They'll want to review your policies and procedures. They'll want to know what staff training was made available. Again, having policies and procedures in place is great. If you don't provide training to staff and they're not familiar with or aware of what their obligations are and what the policy and procedure is in the practice, it's not going to assist too much. If the Privacy Commissioner comes to your practice, nothing much may occur if you're usually responsible and it's a one-off instance. But obviously, if you've had multiple privacy breaches, if you don't have policies in place, if the staff aren't aware of where the policies and procedures are and they haven't provided training, that could have more significant outcomes.
Thanks, Cheryl.
Do you want to go to the next slide? So I can talk
Next
about
slide.
this one as well, Ruth. Ruth talked about personal information being sent to the wrong recipient earlier, and that's what I had talked about as well. So advising your staff that this is rather common. It happens all the time. I know that I've received things, we've had them happen through our practice, but it happens all the time. And it's a human error. Staff are on autopilot. They're working quickly. They're sending information, and somehow they've inadvertently sent some information to the wrong person. So as Ruth had talked about with the OIC, personal information sent to wrong people is 42% of those human errors. Unauthorized disclosure to unintended audiences, things like sending the extra pages in a fax or in an email that has accidentally scanned something else, and then failure to use BCC when sending emails. And you see that quite often, being really cautious to ensure that when sending emails out, if you're sending them to multiple parties, it's always triple checked that BCC is used and that CC isn't used, and you're inadvertently sharing contact details of all of your patient cohort.
Thanks, Cheryl.
So if we go to the next slide, Ruth. So we talked about, again, having a clear policy. In your policy, you really should look at who can send emails, what can be sent, who can it be sent to, having policies around verifying identity, confirming address confirmation. That's one of the things that's really simple. It's like a patch on your security system of your IT. Every time a patient presents to your practice, verifying that the contact details have remained unchanged from the last contact. Consenting confirmation, making sure that patients have provided their consent to communicate with you via email or SMS if that's the case. Making sure that you're identifying patients and documenting. Anything that's sent should be documented, and making sure that you've got the consent to be communicated with by electronic means documented. Having password protection in place. Often when people are sending emails, systems don't necessarily have a way to encrypt documents that are sent, and Ruth talked a little about that, or will talk a little about that, but making sure that things aren't sent unpassword protected or protected. at all, you might consider, if you're sending information such as referrals to specialists, that you have an agreement with that particular specialist practice that every time we send you an email, this is the password, so that you're ensuring that all of your documents that you send to them are password protected. As an example, prior to joining Avant, I was a practice manager of an anaesthetic group. So a number of our specialist practices would be sending us via email theatre lists, which contained a lot of personal information. It wasn't a system capability with the systems they were sending from to be able to add passwords routinely. So we had an agreement that anything that came from that particular practice had a password, and this is the password, that was intermittently updated and changed to ensure that we're not always using the same password. And obviously, if they're sending information to other practices, different passwords are used. So ensuring that staff have system training as well. So that's really building the blocks around ensuring that people are not only aware that the policies and procedures are in place, but they're trained in it as well. And Ruth has also talked about consent, and we've both discussed consent. So making sure that you advise a patient about the risks associated with unencrypted emails. Patients will say they're happy to have that information sent to them, but ensuring that you're advising them of the risks of communicating with them using that method. And if they still want to have that information sent using that method, making sure you're getting patient consent in writing. If it's not practical, sometimes it's not, but just make sure that you're at least getting patients' verbal consent and documenting it in their clinical record to verify that they've been advised of the risks of communicating using that method, and that you've documented that they've provided verbal consent in that instance. If you've got any concerns about their understanding and informed consent about specific emails, reconfirm details. So in the instance that I spoke about with the patient who had terminal cancer, this is a significant communication that isn't usual. So it would be best practice to contact the patient directly and confirm they're happy for this information to be provided via email. Again, advise what the risks of sending this information unencrypted are. And if the patient still consents to having it sent that method, ensuring that you're getting it in writing if that's possible. If not, again, documenting that you've been given verbal consent by the patient to send that information. Thank you, Ruth.
All right, thanks, Cheryl. So the Privacy Commissioner doesn't actually say that whether you should or shouldn't be sending patients' information via email. What they do say is that you need to take reasonable steps to protect the patient's privacy. And there's lots of examples. I know a lot of practices don't use email and they do use fax, but there's lots of examples of privacy breaches with fax. As Cheryl was saying, it's really becoming quite an outdated method. There's one famous story at Avant where a practice was sending psychiatry referrals via fax, and for months, I can't remember how long, but for months they were sending it to an incorrect fax number, and all the referrals were going to the local petrol station, service station, and the service station staff didn't really know what to do with them or where they were coming from, so they just threw them in the bin. But just imagine the sensitivity of that information, and it was in a small town, until eventually somebody mentioned that they'd seen a referral from someone that they knew, and everyone became aware that it was going to the wrong place. So the point is that it's fine to use email, providing you can prove that you're taking reasonable steps to protect your patient's privacy, that you have a policy in place that outlines what you can and can't send, things are password protected, you've got patient consent, and that each practice has to make their own decision about what they will and won't send via email. I guess one thing to flag is that what you can't do via email or via SMS is have a consultation with the patient. So you can't send them information and the patient writes back a question to the doctor answers them, they write back another question, the doctor answers them, because that becomes a consultation and that's not appropriate. So it has to be, here's something, if you want more information, give us a call, make an appointment, and be very clear about that. But what I'm talking about here is encryption, which is one of the reasonable steps that you can choose to employ in most sending and receiving of emails has some element of encryption, but it doesn't really, people don't really understand what encryption means. And so the way it was explained to me is that in the process of sending an email, it sort of has 4 steps. So it goes from your email provider to the server where it's stored, and then from that server to the server where the patient's information is stored, and then from that patient server to the patient's email provider to the patient. And so if you have encryption in your system, it's encrypted on the way there. Some systems have it encrypted from you to the server, but it isn't encrypted as it goes on the rest of the journey back to the patient. And that's things like, you know, Gmail or Microsoft, they encrypt it for part of the way, but not all of the way. If you buy an encryption software program, it is encrypted all the way, and then just by opening it, it becomes de-encrypted at the patient's end. But when the patient replies to you, or if the patient replies to you, they're unlikely to have encryption software, so their response isn't encrypted. So even if you engage in a program, it doesn't necessarily mean the information is secure 100% of the time going in both directions. So that's something to keep in mind. And so one thing we did say was that, you know, sending it to the wrong email address is one of the most common errors. And the other thing that is quite a common error is autocomplete. So when you type in the name Ruth, but there's another Ruth in your system, and so without realizing it's, you know, Ruth Frampton, not Ruth Crampton, and then you send it to the wrong person because the email address automatically populates. Sometimes mistyped emails, accidentally using reply all, patients with more than one email address, but they may not be clear about which email address they want you to use. So those types of things can cause problems. One thing that I've heard some practices doing is that when a patient fills in their patient details form when they first come to the practice, and those forms should be regularly checked by reception when people turn up for appointments. They, you know, say, yes, you can email me, yes, you can SMS me, this is my phone number, this is my email address. And then the practice then sends them an email, just a routine hello email, to just confirm that what was written and what they've typed in is the correct email address. I once had a situation where my handwriting was so bad that an organisation thought they were emailing me, and it was a list of physio appointments, and they thought they were emailing me to confirm each appointment, but I never received an email. I was just turning up because I'd, you know, remembered when the appointments were. And it wasn't until several months that they realised that none of their emails had been getting through to me. So sending an email and asking the patient to reply to confirm it was a correct email address can be a good idea. As we've mentioned, password protecting sensitive information, having a standard password, such as the person's postcode or birth date, or other type of information like that, I think we've mentioned. One thing we haven't mentioned is the use of a disclaimer at the end of an email. So there should be several different types of disclaimers on your emails. There should be a disclaimer for the general practice email, and I'm sure you will have one that says, if this is an emergency, please, call 000 or something. This email is not regularly attended or something. But if you're sending the patient an email with some other content in it, you need a different disclaimer, and it's one that says this information is confidential, intended only for the individual whom the email is addressed to, that type of thing. And there's an example of that in our email fact sheet, which we've sent through for you guys to have a look at. One of our risk advisors has this mnemonic that she likes to use when it's talking about emails, and so that is can do. So Cheryl, did you want to talk about this?
Sure, yeah. And one of the suggestions is that some practices will print this and laminate it and sit it right next to a fax machine. Put it on the reception desk in front of the computer, so when people are about to send an email, they look at this, and even to cite can do, and to remember to stop. Make sure you've got consent, whether you're sending the email or fax to a patient or to a third party, and ensuring that you've got the correct consent to do so. A for address, making sure again that you've got the correct patient email or third party email address, checking all of the checks that Ruth had talked about as well, making sure you haven't inadvertently got an autofill. So double checking before you press send is really important. I know I've done it, and I'm sure everybody has done it, where you've sent it to the wrong Ruth, and it can be challenging if you do that, and you've then inadvertently sent some patient information to the wrong person potentially. Name checking to make sure. For example, with our practice, I know that there is another child in our practice that has the same name as my daughter. And every time since she was a baby, we've always had to confirm what her date of birth is. They always double check to make sure they haven't inadvertently picked up the wrong one. So certainly if you've got more than one patient with the same name or the same recipient, make sure you're checking that you've got the correct date of birth, address, and that this is on all of the pages of the information that's being sent. So again, making sure you're not sending inadvertent information that's been attached. Documenting. So documenting whatever's been sent. So it's not a matter of just saving in your sent items, making sure that there's a copy of or reference to what's been sent in the patient medical record. You don't want to inadvertently create a hybrid system where you've got information that's been sent to a patient in your email system. However, that's not in your medical record or a reference to it, so that when the patient does present next time, there's no record to show what information they've been provided. And O, again, for owner password, whether you've got a password which is the patient date of birth or whatever it is, making sure that there is some protection in place with that email. And once all of those checks, so the can do check has been checked, at that point in time, then press send.
So we do have a fact sheet, flow chart for what to do if you suspect a data breach. That's available in the information that we have sent through to you, and whether how to determine whether or not the breach is serious. Like we said, serious, significant information about a few people, or quite limited information about a lot of people is what they consider to be serious. So just finally, that the documentation when you're emailing someone, you need to, if you practice decides, does a risk assessment and decides that you're happy to email patients, you need policies and procedures in place. You need to remember that what's emailed to the patient should be part of the medical record. So if it is just attaching results, the results will be in the medical record. But if it's some other kind of information, you'll need to save that in the medical record. Make sure the staff is well trained, and that you know, in the workplace you're happy to discuss issues or any learnings that you can have from any mistakes that have been made. And there is situations where email is inappropriate. As I said, anything that's an ongoing back and forth between a doctor and a patient, or a practice and a patient, is inappropriate. Even if the patient has consented to receiving email, there's some information that just isn't appropriate to send. Any particularly sensitive information, anything that requires a consultation for an explanation, anything that's got an abnormal result that's significant, you know, not just an elevated H or a low HB, but, you know, something that's a biopsy result or something. It's the doctor's clinical judgment that comes into play there as to whether or not they are what they're happy to be sent by email, or what's necessary for a face-to-face consultation. And so finally, I think
sorry, Ruth, just while we're on emails still, can I just relay a question? So it's not really a question, it's a statement, but there are questions around it, I think. So we have a practice of asking patients to send an email requesting us to email the information. Now, I presume that is okay, and I would hope that that would be scanned into the medical record.
Yeah, that's a good practice.
Yeah.
And sorry, Trish, my internet's a bit crappy, but
would it be better to do that each time?
Because then you have, you've got the email address, it's implied consent, and then you can respond with the results. Yeah. Okay,
great. And is there a specific format that we should have for patients to request? I think it's probably just what we've said.
Yeah. There's not a particular format, but I think the practice should have a set pro forma that you use that's got a similar wording, that everybody uses, so that it's not bespoke for each patient, or depending on who's sending the information, that there's a structure practice uses. Yeah.
Fantastic. So can I just clarify from my perspective? So encryption is the best option. Password protection next.
Yeah. Yeah.
Confirmation each time. Yeah.
Yeah. Your consent, and then if you send something and if you want to ensure the patient has received it, ask them to respond or put a red receipt on it or something, or follow up with a phone call or an SMS. Often practices send email only in response to a patient request for it. Can you please send me my results? But if you're going to be, some practices use it to say, your flu shots are here, or, something general like that, the response doesn't necessarily matter. But if it's results and things, depending on how serious that is, you may want to confirm that they've received it, or call them to tell them that it's coming, or something like that.
Okay, great. So I've just got another one. So could we have a suggestion on a format, a standard format, I suppose? Do you have any templates available? Or that's to ask a patient for consent. And
certainly when we're talking about consent documentation, there are some templates on the Avant website. There's certainly advice that we can send you some resources about what should be included in the consent. So ensuring that it clearly defines or demonstrates who the person is that's providing consent and what they're providing consent for. So if you're having everybody complete a new patient form when they first come to the practice, making sure that patients are aware what they're signing. I did take one of my children to a specialist yesterday, and filled out the new patient form, and noticed just to the right of all the information I filled out, there was a tick box to say email communication. Note to self, it didn't really talk about what it was going to include. So the assumption is they'll be emailing, and there was also an SMS box. So I'm assuming they're going to contact us with information about when our appointments are, but ensuring that having some information on that consent so that the patient is providing their informed consent, even though it is a new patient registration, making sure patients understand what they're consenting to.
Okay, that's great, Cheryl. Thanks very much for that.
I'm going to risk it with my camera on for the close. So I think just to reiterate a couple of key points. One is that to employ experts to help, get a second opinion. Those experts may not be your current IT providers. You may want to get further advice. Policies and procedures are key, and planning to be prepared for the potential of what might happen, and that it's not enough just to have the policies and procedures. You need to have ongoing training and vigilance with your staff, practice runs, so that people know what to do, so that you are prepared, because bad things can happen. So that's it from Cheryl and I. We're very happy to answer any questions. And there's quite a lot of information on our website. If you just Google Avant cybersecurity, you'll probably come across most things that you need.
Sorry for the delay, everyone. I've just popped up the session conclusion slide. I can't talk. Just while that's up there and you're all madly checking that through that QR code, I'm thinking I haven't touched a QR code for a very long time. But, and that's a good thing, I suppose, from the perspective of it became very famous during COVID. I just wanted to check. So we're talking about getting the right advice around security in our systems. You know, there's a lot of industries that have got a code of conduct, have got a peak body that lists those that are reputable suppliers. Is there any such thing for IT support and particularly security support, do you think, with IT systems?
There certainly are people out there that specialise in it for, you know, health practices, but I don't know where a list would be found. Any ideas, Cheryl?
No, I am aware that there is an organisation that if any of our practices do have cyber breaches that we refer members to. I haven't got their name immediately, but I know they have some resources and some recommendations, so we can send that link through to you to be able to share.
Then we could distribute it with the other information. Thank you. It's been very informative for me anyway, and I hope it has for the attendees. Please give us your feedback, everyone. This is how we make sure that we improve and that we continue to provide the education events that you want, not the ones we think you want. So it's really important that we get that feedback. And any further events you wish to attend, I'm sure you knew how to find this one, so that's the link. Otherwise, ring the PHN. And as we said, the session was recorded, and you'll be able to view the recording at this link within the next week. Oh, I'd said 3 weeks, 1 week. That's fantastic. Ruth and Cheryl, thank you so much for spending the time with us this evening and for providing all of that information. And I'm sure there'll be lots of hits on the website to get further information from you. So thanks very much.
Thank you.
Okay, goodbye, everyone.